This is Hold My Stethoscope.
Hi, fam. No, I just went live. Hello. We are live. I think we're live. Not exactly sure because, well, we've never done this before. So,
Thank you.
so this is Felicia's house. We've got some special guests with us here tonight, and I absolutely love this setting. Felicia has killed it once again with the decor in her house. It is gorgeous. It's just look at these pillows, guys. Look at these pillows. I'm obsessed. That's all I can say is I'm obsessed. All right. So got my other crew coming to, I think, come see us here in a second.
Okay.
Oh, they're busy apparently. But I'm just gonna post the link one more time on our social media. So for those of you that are able to join us live, super exciting. And then otherwise, this will be recorded as our last episode for the season. It's crazy that it's already happening.
I don't want to talk that much.
One of our special guests has already requested not to talk that much. That's gonna
One of
be
our special guests worked all day while the other special guests just got to sit at home.
not true. I actually was teaching today, and then here's our other guest. Hey, so we are hooked up to the microphone here. Oh, so I look at this.
Come sit, everybody.
Come sit. We're gonna go coffee.
Additional lighting. Look at that lighting.
Lights look great.
Oh, and over. Hi, everybody, and Merry Christmas. We're
I should
very
have
excited.
fire
Going in the background.
Oh yeah, put it on. Put some fire. We're gonna get toasty. We're getting a real life. Having a real life.
Kenzie usually does it. Sorry, I don't know how.
Dom, I'm gonna need you to get on fireplace duty, please.
That's how it works.
Wait, what is
I
it?
was just talking.
Brand can take it with him. It's over 23 years.
What?
With all these.
Oh yeah, maybe. It's so fuzzy. It's literally like a winter wonderland.
That's what everybody's is.
It's like
One wonder.
crazy. And like this is one part. Hopefully, I'll be able to take this around and show you the rest of the rooms for those of you that are watching because it's just like it's gorgeous. I love it. I know these pillows.
Not so.
Alicia, get us started. What's going on with you, girl? Tell the people.
Not a whole lot is going on with me these days. You know, with the exception, I still have that gut punching abdominal pain that we talked about last episode. But, you know, thanks to my dear husband who massages my back, gets it out half the time, and I wake him up through the night, I am surviving it. It is more likely either my stent or just from the radiation is what I'm being told. So that's kind of like what I'm dealing with right now. But other than that, we're at a sit and wait, guys, as far as what's going on with the tumor. I can't tell you that it is shrinking.
Look at that. We got a guest. My mama joined us.
Yay!
Hi, mama.
My favorite girl.
Felicia live on the flash.
Yes.
So, yeah, my mom is one of Felicia's biggest fans. So it's super exciting that she's joining.
Yes, I'm excited. But other than that, you know what? I'm truly blessed and grateful. I'm here to see another holiday season with my friend. So I'm beyond happy about that.
I don't know if you can see her earrings too, but like I love them. They're beautiful. I'm kind of jealous. Mine only say Mary's.
I got
the
the
earrings.
trees
I
for
love it.
everybody.
I love
the
it.
trees.
All right, and then we have our two special guests. We've got Anthony and we've got Dom here again. So we did tell you that this was going to be an FK Bad episode because we finally thought we could get all five of us together in one space in one sitting. Well, that didn't quite work as planned. We've just got a F Bad right now. I don't know when. You're going to have to stay tuned. You're just going to have to keep watching to get us all together. The fact, though, that we're all in one room is actually pretty crazy, though. Because it's been a while since we've all gotten to, like, see each other. We had dinner when you were back for a minute during your retreat. Yeah, other than that, we were all, like, busy and obviously living our lives. So, Anthony.
Hi.
What's up with you?
School's semester's almost over.
Yay!
2 more days. Big test on Friday. Had an exam on Monday. I went flying yesterday.
You went flying?
Yeah.
What do you mean you went flying?
One of my friends is learning to be a pilot, so he asked me if I wanted to go up in the plane with him, and so we flew to another airport.
I'm gonna need you to
Know that friend.
do those things. Yeah, until the food.
Yeah, we flew to another airport. We got tacos at the other airport. And
You weren't scared?
So, like, how far away did you go?
like 40-minute flight.
Yeah, but you know these flights are ending up on the highway, ending up like hitting people's homes. I'm just a little nervous.
Well, I was kind of hoping we would crash because then I wouldn't have to take my last exam.
No, sir. No, sir.
Oh my God.
That's not what I want you to say.
And you were saying your whatever final exam on Friday is a predictor of how well you're supposedly supposed to do on your national boards. And it's like a big part of your grade.
Not really like our grade, but like they use it to I kind of tell where we are, like what remediation we need, and like how we're going to move forward in our.
So it's a pretty big deal, yes.
Stressful,
Yeah.
boring.
Stressful and boring.
That is true. That's actually spot on.
We'll put this closer to the guys while they're talking.
Yeah.
I mean, police have pretty loud voices anyways, so.
It's really good at handling it. What else is going on, Anthony? Tell us more.
No, all I want to do is study. That's it. Wake up, study, take a nap, study.
Go back to
Goes
sleep
on.
at night.
Go to bed at 8 p.m.
Boring
Where's your actual
thing.
Yeah,
It'll
where's
be
your
more
microphone?
exciting in like 2 days.
When school is over,
Yeah,
and
why
I
not
can't wait
be
to
a
hear
person?
about how you felt about your test.
We all
You're gonna do great.
I know
That's
he
what
always
Robert
does. He does. He just
Mhm.
does a good job. And if he doesn't, he probably will be telling the instructors something's wrong with this test. I'm telling you, maybe that's what he did
No, I'll
before.
just be crying. But then it'll be
No.
fine.
He told somebody about a test that
Yeah, I did.
You did. Yes.
But that's fine. That needed to be said.
it did. And
Okay,
now they
nice.
have a really hard test, just by the way.
Well, I passed my test and my STD panel is negative.
Oh God.
What's going on with you, Dom?
Oh, Dom. Fun mess. We love
The
you.
one you all been waiting for, the star of the show, who steals the light all the time. Everything's good with me. I just got a lot of work coming up. I'll be working 5 days, 6 days, and 6 days up and through the holiday season.
That's what he gets for going to New York. So
Yeah.
he just took a little vacation and went to New York, and now he's getting punished on the back end.
Yeah.
You gotta pay off those trips. So yeah, I'll be working my butt off. I don't know where,
I don't blame you.
but it's
Dom.
happening afterwards.
I
So
don't blame you. Live your best.
I also didn't get the memo that we're wearing white as angels today. One of us worked while the others just got to enjoy their day.
All of us worked as well. So I'm sorry.
12-hour shifts because then we can go toe to toe.
I don't do
Exactly.
12-hour shifts. I work 5 days a week. So let's
Lord.
talk about it.
And I'm working
Lord help
5
us.
Okay, back on track to me. Our girl here. No, everything's going well. I had a wonderful time. Now we're just getting ready for the holidays.
So the stuff was up when you went, right? Like all of the Christmas stuff was up.
The tree wasn't lit, but it's okay.
Is it lit now?
It is lit now.
In New York, yes.
And
yes.
it is packed.
I bet.
Every corner, no matter where you go.
Yeah,
I'm
Wow,
sure.
it's New York City.
yeah, it is.
Yeah, that's crazy.
I just look at my own trees.
Rachel looked there. We had a great time.
Oh, Rachel went?
Mhm.
You went to see her? She met you guys? Nice.
She met us in New York. We hung
Nice.
out for the day and everything.
Great.
That's
awesome.
That's exciting.
Yeah.
Exciting, Mr. Dom. He's got his
Lot of
lovely,
A lot of love. Heart.
lots of love, lots of love. That's funny. I can't really see in here. Hold on. Sorry, guys. Like I said, we're kind of just going with it. Oh, we're blurry, my mom said. Thanks, Mama. I don't really know. Oh, and we moved the light. This is going to be a fun podcast for you guys to watch back or listen to because
See what
while we went live, none of us know what the heck we're doing, so it's fine. But that's us as ER nurses, just MacGyver things as we go. And this is my light. So we're just going to put this over here. I don't know. We're just...
Man,
that was good.
Dominique, if you break my crystal.
Let's come a little closer.
Okay.
There we go. You know what? We're going to be
Yeah.
intimate. We're going to be way more
Leave
intimate.
it up there. It was great.
Okay. Brittney back. God bless.
oh, nice now.
Oh.
I mean, it's comfy, right?
Yeah, it's really not
Wait,
bad.
wait.
She keeps saying that this is like an old
It is.
couch, but it's comfy.
Yeah.
And it's, like I said, decorated so nice.
I try. Thank you very, very much.
We'll give
I
you all
did
a
that.
tour after.
Yes.
Yeah, we'll give you the tour.
Yes.
Anthony will narrate for us.
Bye, Anthony.
Yeah. So we got Anthony, and then we got her Anthony, and then I have an Anthony. There's a lot of Anthonys in our
Yeah.
lives, so it's all good.
Y'all are the best. Okay.
Yeah.
You know what? I agree.
Thank you.
Yeah, I agree.
I don't think so. D's are the best.
I think
Please,
that's
no
I think
further
that's a-
comments.
Oh my gosh.
And these are all like
I can't. I can't. Oh boy. All right. Anyways, my podcast.
Wait, why are we here?
Yeah. Why are we here? What are we doing? That's funny because I was like on the way over, and of course I'm running late because if any of you know me, I just can never be on time. So I was coming over, and of course I was behind Dom, who Dom actually once again did work 12 hours and come over here afterwards, but came over afterwards, and I was thinking, and I was like, you know, it's crazy to me that we actually have a podcast.
I know.
Who, like, honestly, like, sometimes I'm like, who are we? Like,
Yeah.
we're just people, and we decided to pick up a mic and tell our stories. Like, I mean, we're nobody really special. We're just here doing a thing. And the fact that we get people to, like, listen to us is just wild to me.
Yeah,
Like,
it
oh, I
is.
didn't even tell you this. So one of the respiratory therapists at my current job, she came up to me the other day and she was like, you know, I watch your podcast. And I was like, what? So I was like, it's
Oh
really
my God,
fun and
that's awesome.
exciting. Like, that's really cool. So shout out. Thank you for
Shout out.
watching.
Thank you.
Yes,
Holidays.
Yeah. We're just blessed that people want to listen to us. So what kind of fun things have been going on at work, Dom? We're gonna go with you since you've got 12 hours to crown of the winner who works the most here.
Today, well, you know, the shenanigans started right at the start of my shift with 2 back-to-back stroke alerts. Fortunately, they probably both needed TNK, but they were both out of the window with their wake-up time frames. I'm gonna last see normal as last night before they went to bed. So one did go for a large vessel occlusion removal, sent over to a larger hospital. And the other one stayed with us that we were able to take care of. Shortly after that, our systems went down for our phones, so that was fun. No phone service for about 2 hours, no texting, no calling, no pages coming to your phones with patients being admitted to your rooms and stuff like that. So it's a little chaos. On top of all of that, we're opening up an overflow unit because we have holes in the ED, and I have a very large surgery scheduled. So move some things around. Systems finally came back up. Huge win. The majority of my day, I had a code labor, but we were able to tuck it in and run to the room, and we
Tuck
successfully
it and
delivered.
run. I like that.
And we did have a stat C-section. So we had a stat C-section. They needed assistance on the unit. I came up with, I don't do much, just so you all know. I come and I answer the phones. But I'm there to support my team any way that I can by answering the phones. While they deliver the babies and they take care of mom. Well, if anyone in LMB is aware, they call it a splash and dash sometimes. You just have to get them in the OR, cut them open to get that baby out. The baby's heart rate was 40. I had to rush to get the baby out. When they did get the baby out, baby was fine. Birth was great. Did not need NICUs. Beautiful. Fortunately, when they went to go extubate mom aspirated
Oh no.
and then required reintubation. After some deep suctioning and after about 2 hours, they were finally able to take the tube out and recover her. And she is happily with her baby now. And they are successful. That was the majority of my day. And there's tons of other shenanigans that I can go on, but we'll save that for another time.
Why? We don't gotta save anything. We'll just
I
keep
mean,
going.
more shenanigans. It's a little too specific. So
Oh, okay. All right. We'll leave the specific shenanigans to off the
Yeah.
air.
I'll give you one more.
Okay.
One more shenanigan.
I knew more shenanigans were coming.
I'm outside the mom baby unit, and I'm like, is that a fire alarm? Sounds like a fire alarm. I'm walking towards the mom baby, and I'm like, well, it's not a fire alarm. It's flashing yellow inside, and it's our hug tag system going off because the baby is possibly missing.
What's a hug tag?
So they have these special tags that they put on mom, dad, and
Yes.
baby.
Yes.
Oh, okay.
Baby has a very specific one. It's kind of like a ink monitor.
For a newborn?
Yeah, for a
Yeah.
newborn. Well, mom knew she was being discharged. Thought it would be okay to cut it off. Cut the band. The alarms went off. All the doors locked. No one can get in or out except for myself. So as I'm walking in, I'm like, well, y'all can go figure it out. But I'm like, all right, let's see. I'm looking around. No one in sight. That's a great sight to see. No one's in sight and the alarms are going off. Okay, fine. Walk a little bit further in. It might be this room, but I'm not really sure. I'm like, and no one's called a code pink. And if anyone does not know, a code pink is a baby abduction. That alarm goes off, it should be automatic. We need to be looking for these babies, where it's going. Long story short, it was a mom. She got excited. She's going home with her baby. She cut the tag off. It set off the alarms. Put a little panic and security in everyone. Hey, she needs to do this mom.
Oh, that's true.
She got sure strength. She wanted to go home.
Yeah.
But yes, we were able to deactivate the alarms and then back to business as work.
Okay.
So you just did
Now that is all.
That's all.
Why is it?
That's pretty good.
I guess it's good. It's hard to abduct children.
Oh,
It is very hard to abduct children. Your fire alarm distraction does not work with this. We
So
are
do
not
you
working.
remove those before they leave anyway?
We do, but we deactivate the tag first.
Got it.
And go and remove it from the baby. I'm just not.
Are they like single use or can you use the same tag again?
You can use a little thing, but the strand itself is individual. See how like a microchip in that, so like knows when it connects and when it snaps.
So for any L&D nurses out there, sorry, clearly as former ER and an ICU nurse over here, I have no idea about any of this stuff. So God bless you all because love that you do that because that's not something.
Please help us bring those down to the ED for our Baker Act patients because our ED would love to have. Anyone looking to make money? There's your pitch.
That's true.
Yeah.
Don't be giving all our secrets out to the world there, Dom. We got to work on this in the background here. Goodness gracious. All right. Well, I'll give you that. That was some pretty good stuff.
That's pretty good juice.
Yeah.
And at the end of the day, I still have a smile on my face.
You too.
Dom always has a smile on his face somehow. I think he's on drugs that he doesn't want to share with us. So it's really kind of unfortunate sometimes. But
They're on their own. They have to find their own happy pills. In reality, when you don't have to take work home, it's amazing.
You're right.
That is
Yeah.
true.
I get to
That's-
leave.
Yeah.
My shift ends. My work ends. I have to take nothing home.
Me too.
Where you do it?
Anthony, any fun patients you've put to sleep lately? You just
Hey, no, I mean, I was in OB a couple weeks back, and actually we had a mom who, for those of you who don't know, when you're going for a C-section, they do something called like a spinal, and you get like a small dose of medicine right, like essentially into the spine. It makes the lower half of your body numb. So we did the spinal on this mom, and she could still feel her legs. And a lot of times it's just because it's like hasn't had enough time to work, or like gravity can play a factor. So like we waited, and then I'm talking to the mom, and the mom's like, "Oh yeah, with my other baby, they poked me like 7 times, and it never worked." And I was like, "Oh." And then I was like, "Oh no." So yeah, there are some people out there who like local anesthetics. They don't work. They don't work.
So what do?
You had to go to sleep.
Okay.
Oh, like
Yeah.
you literally put her under.
And we had to put her under.
What men?
But how?
You
Okay,
have
so
to be
this
careful
is
what meds you
this
use
is probably
because-
dumb.
Right,
But like,
because
how do you
of the baby,
put her to
right.
sleep and then she's still in labor?
They got to do
So-
a C-section then.
Yeah, I mean, she was a C-section.
yeah.
So
I was like,
we were going in, and so we did the spinal, and like they set up regardless. Usually, like we test, we like
Yeah.
feel here, do you feel
Mhm,
here,
yeah.
and then like we're like, okay, they're good, and then they drape, and drape goes up. She's
Can't
awake.
feel down.
But so like I'm still a student, and so I'm testing mom. I'm like, can you feel this? Can you feel this? She's like, yeah, yeah. And I'm like, huh. And then I like get a different object. I'm like, okay, this is sharp. Like, can you feel this? Does this feel the same? She's like, yeah. And I'm like, and my preceptor looks at me. My preceptor was probably thinking like, you dummy. Like, oh, to me,
Oh.
because they're like thinking that I'm doing something wrong. And then my preceptor was like, okay, wait, does this feel the same as this? The mom's like, yeah. So the spinal just never set up. And so then the anesthesiologist comes in and does the exact same thing.
And
Does
it
this feel
still
the
didn't
same as
work.
this? It still doesn't set up. So,
So finally, the patient tells you guys it took.
well, so now there's a lot of chaos in the room because it's like suddenly things are kind of different than what's supposed to happen. And so people are talking and things are going on. And so I was just talking to mom, being like, oh, like sometimes medicines don't set up. Like we have other options. And then she
And
told
then
me,
she
she
said-
was like, oh yeah, with my other baby, I had to be poked, or they tried to do it a couple times and they ended up having to put me to sleep. I thought that was crazy. Local anesthetics don't work on her. And there are some people that doesn't work. And usually people find out when they're at the dentist because they use like local
Oh.
anesthetics on their teeth.
Mhm.
And that's like kind of translates into spinal as well.
Because we use the same class of like lidocaine. But it's not lidocaine, but it's the same class of drug.
Mhm.
So yeah, it cannot work on certain people.
So could it potentially work on their mouth and then not work on their spine?
No, probably not.
Listen, I'm all about learning
Yeah,
some
I'm
new
like,
stuff all the
I
time.
guess
so.
in theory, because you could use a different class of drugs, but they don't typically, because you're putting it right into the spine, like there's a lot more risk.
Right.
So yeah, there's like 2 different classes of locals. And so usually if you have like an allergy or you don't respond to one, you can use the other ones, but they don't usually do that.
Well, that's your tip for the day and
Yeah.
things we learned today.
Yes.
Oh my God, she's
Yes,
so crazy.
Her and the baby made it. But what
Oh.
is interesting is when you put mom to sleep like that, they really worry about like the drugs crossing
The
into the
placenta,
baby,
yeah.
the placenta. So when you induce, there's kind of like a communication between the person who's inducing and the surgeon. So they get all ready. And then right as we induce, they start like a clock. And then we have to try to intubate as fast as we can. And the moment we have the tube secured, we have to tell the surgeon and they cut.
Wow.
And then it's 3 minutes from drug push to baby out.
It is
3 minutes.
3
Wow.
minutes to put that uterus
How-
out and all of that.
They do it. It's
I know
kinda
they do.
crazy.
And it's great.
I've seen it.
What is typical, like, when you do like that? What is typical for them to like deliver the baby after you do a spinal?
I mean, they're usually not like in a hurry, but it's not very long. I mean, they're a little
Just
more
like-
careful. I mean, not that they're not careful in these other scenarios, but they
Yeah.
just there's more haste.
Right.
because Medications we're
minutes.
using to put mom to sleep can put
Put
baby to sleep, and then
which
that's
then
more of an issue.
that
So it's
Apgar-
this fine line of, and they call it the same thing, splashing down.
Interesting.
I love it.
Well, yeah, because when you first were saying that, I was like thinking, I was like, okay, this lady's getting a spinal. Because you normally think about that, I don't know, mine when they're getting like vaginal birth and trying to get them an epidural. That's what I was going for.
Mhm.
So it was like, how are you putting a patient who's having a vaginal delivery under? Okay, thank you for clarifying.
Yeah,
because
no,
I was
she-
really not understanding that my brain cells. Unless they're OB people.
Yeah.
Well, it's funny because so my sister-in-law, like she, they recently moved back to our home state, and like she's actually doing labor and delivery now. So she's like doing this whole new role, and I was like, how is it? And like the way they kind of train is they do like mother baby, and like and they go through like the different stages, and then they progress to like labor and then scrubbing in the OR. So they do a lot of different orientations. And she's like, it's good, but it's stressful. And I can imagine it being with like the liability with, moms and babies and different things that could go wrong. So there's so many things
Right.
that can go wrong during them. It's actually crazy. I feel like I recently or heard, I don't know, read, whatever, I'm a little bit of a nerd here, that we're really showing some of like the worst like birth rates and complications than we ever have, which is very surprising. And then I know, there was like a national story about, the mom that was taken to an ER and told to
Oh yes.
go away and
Yeah.
then had the baby in the transport, and poor outcomes were had.
Mhm.
So it's just kind of sad in this day and age, like how much technology we have, but yet
That
still
still
things are
just- yeah.
happening like this, that there's a huge maternal mortality as well as like fetal mortality.
Mhm.
So it's just, I don't know. It is wild to me.
Health literacy, lack of access to care.
Yeah.
So if he didn't speak into the mic, he said lack of access to care. I was like, I couldn't even hear him, but yes.
And health literacy, it is kind of, we're all in the medical field, so we
Yes.
understand it a little
Yeah.
bit. People who like this isn't their day to day, they don't know. A lot of women, like if they're not actively trying to have children and they just get pregnant on accident, like they don't know that they're supposed to be taking like
Prenatal.
prenatals or going to
Yes.
certain checkups, or there's a lot of like, who tells you that?
Well, it's true. Like, I wonder, actually, speaking of this, and this is probably, I don't have kids, so forgive me if I'm wrong. I'm like, do they still do like health education, like classes in school these days? Do you guys know?
You know what? That's a great question.
I think they
I don't have any kids.
But no, in school, are they still providing?
Like, I know when I went
Me
to school,
too,
we had
right.
like a
Health-
a
You have
health
basic
class.
health.
We did too.
You don't go through all the sex stuff anymore. It's
Yeah.
not as dope.
But so they don't have a health class anymore.
I mean, they have a basic health class, but
they're not like, you need to be on folic acid because you need to help the neural tubules develop in the first 3 weeks.
this is the body. This is the heart. Here are the lungs. Lesson is concluded.
Boy.
I do think there's a huge part in general of healthcare literacy,
Yes.
because people don't know. they're
don't.
so uneducated or undereducated. And I feel like we talked about this at one of another podcast is like how important, like even when we're discharging patients, like that can be to really go over stuff with
yeah.
them because we know this is our everyday life. Like we know this stuff, but like a lot of patients have no idea. It used to be simple, like you sprained your ankle, you did rice. Like that's not even, I feel like,
That's
common
not.
these
It's
days.
not.
So there's just a lot more like lack of education when it comes to this. Which is funny though, because I feel like now with social media and TikToks and all of these other
That
things
it
that you
wouldn't
have,
be
like you have more access to
access, but
information, but is that information correct?
Exactly. Are you getting the right information? Or
that's
not?
true.
Then, or-
And the wrong information.
Yeah. And then even like with, I don't know the whole story. I just heard a little blurb about that mom, but like it happens to kind of where I work. Like we have a specific women's hospital right across the street from us, but we still get pregnant patients that come to our side of
Yes.
the hospital.
Right.
So, I think there is a lot to be said too about, where are people being told to go or,
Right.
or what are they hearing
Right.
or like, in that moment, there's a lot of factors into everything. There's a lot of
Well, I
factors
mean,
to a lot of
even
things.
think about, you're right. There's a facility across the street, but
Yeah.
they don't realize like the people are like, there's a bridge. They connect, but they don't. Do you know what I mean?
It don't. Yeah. Right.
Yeah.
If you're on the outside, it seems like you can walk in one side and you'll get your.
I mean, and most people would think to go to probably to the women's hospital, but then they would be like, nope, you need to go.
Yeah. I
It's
feel
a
like there's a
lot.
lot of conflicting, even
It
from
is.
healthcare providers, conflicting information that
Right.
people are given. And obviously, as a layperson, that can be hard to be like, well, who do I listen to?
Right.
Because, I mean,
Yeah.
And then coordinative care too, because like you think about it, if you even have like a healthcare team, right? You have a primary doctor, but then you go see, a neurologist because you have headaches. I mean, you have to go see, a urologist because I don't know, you keep getting UTIs, and then you've got to go see a pulmonologist because you have
Yeah.
asthma, and there's just like a lot of different specialists that you're having to go to. So there's a lot of like probably miscommunication with like care too. It's just a lot.
Care because I have 2 medical oncologists and I always get conflicting information and you sometimes don't even know who you're going with. Like which one is it that you really want to deal with? Or as far as what they're saying, like I sometimes have to go and like research to be like, well, wait a minute. Well, I understand what this one's saying, but that ain't gonna happen. Like in my mind, that's how I see it, or whatever. So I do get conflicting information, even from 2 people that actually are the same types of providers. So I can't imagine people who aren't in the healthcare field,
Yeah.
how they feel and what they feel like they should do because this isn't my specialty. And I'm like, even like, I don't even know. So I feel bad.
Well,
for
it's
them.
true because you have like even specialists, like you're talking about medical oncologists, like they have their own practices. And people in the same practice that don't practice the same,
Right.
so like what level of research are they talking about? Who's
Exactly.
willing to try new treatments? Like what options have they seen work personally?
But what I'm
statistically?
learning is that certain things that we may think, okay, say for example, in the cancer world with clinical trials and stuff, like everybody's like, well, why can't you get these clinical trials? But the part that they don't know that I learned today is that these clinical trials are like this. If you have taken this particular chemo medication during your treatment, you can't do this clinical trial. If you have taken radiation during your treatment, you can't do this particular clinical trial. And these are the things that people don't know out there when they are researching and they're like, well, there's plenty of clinical trials out there. I don't understand why you can't get one. But you have to know the background of what my treatment has been like in order to even qualify for one of these clinical trials. Like, that's just the way that works. And that is something I didn't know. I learned that today through one of the other medical oncologists. So there's a lot of information out
Well,
there.
kind of going with that, like, I don't know if you said it earlier, so forgive me if you did, but you were talking last week about you had the meeting with the oncologist from Sloan and potentially putting you on a oral chemo or the PARP inhibitor, but you did have the appointment earlier this week. So where are you at with that?
So that was discussed in the appointment this week. And the conclusion was that I would not be put on this PARP inhibitor because this PARP inhibitor has a criteria, and one of them is that you have to be in a position of where you have metastatic cancer. So thank God that I don't
Thank
have
God.
that, which is why I would not qualify for that PARP inhibitor that he was looking at putting me on. So there are criterias with stuff like that as well. And that's the conclusion that we came up with. Now, here's the deal. Right now, I'm not on anything, which is a little scary for all of us because it's sort of like, okay, you're not on anything. What if this tumor decides that it wants to start growing again? How do we know that there aren't still cells in there that are producing cells that are growing? And that is one of those things. I'll just show me the algorithm today as to where I am. And there's like 4 different options that sit there. For one of them is to put like me back on sulfonyls. I'm not going back on that. That was the chemo drug. It was brutal. And even the doctor was like, we're not putting you back on that. But one of them is to observe the person. And that's kind of what Sloan has decided to do. We're going to take this time, enjoy your time off of anything, and we're just going to keep an eye on you. The thing that people don't realize is that even getting CAT scans they can't decipher if it's inflammation, scar tissue, or if it's actually the tumor. A rat can't read it and know because they can't look at it and be able to say what it is. So this is why radiation oncologists say wait 6 months, 3 to 6 months, at least 6 months, in order to see what that tumor is doing post radiation. So I have to just trust the process and pray that this tumor doesn't grow and try and enjoy my time off of anything. I will tell you it's nice to start seeing the color of my hands come back again. And, now if we can get the feet to stop tingling and numbness and stop dropping stuff. I feel like I put stuff in my hands and it's like falling right out, from earrings to whatever. That eventually over time could possibly go away. So that's kind of like my hope with that.
Do you want to discuss what you had your CAT scan? You want to go into that, or you want to?
Sure. So I had a CAT scan done last Friday, which I'm very grateful for my, hospital team who loves me dearly and always makes it a point to get me in, for testing. That if I was someone that didn't work for that organization, I wouldn't have it by now, just so you know. So I was able to do my CAT scan on Friday, and luckily, because of the relationship that I have with so many people, someone was able to read it right then and there while I was there. I was pretty excited. So I sat there and we read, he read it and walked me through it. And, it was so interesting because the discussion was, let's make a comparison to like your previous 2 CAT scans. And I was pretty super excited about that. And we did. And it showed shrinkage, which I'm very happy about. Yay. However, we were looking at the current one, and honestly, we couldn't see the tumor. And I'm not kidding you. Like the tumor that we could see from the July CAT scan, from the May CAT scan, even though from May to July, it showed a little shrinkage, honestly could not see the tumor on the one that was done on Friday. It was like, I don't know where it is, but we don't see it, which made me very, very, very happy, but very, very, very nervous. Like, whoa. And so it was sort of one of them things that I just felt like until I saw a final report, I didn't want it discussed. I didn't want it put out there because I didn't want false like hopes and stuff like that put out there without having definitive information. And I'm glad that we waited, because when the final read was done, it didn't show what we thought. It wasn't saying like there was no tumor. It does show additional shrinkage, which that's not even what we were looking for. We was looking for the gut punching pain that I've been feeling to figure out why that was going on, which, by the way, everybody is gas. So yay, glad it's that, and not that it has metastasized to the liver or moved on anywhere else. It could also possibly be because my stent is hanging halfway out. So
See that on the CAT scan?
oh yeah.
Yeah.
So they could definitely see that. And I think the plan would be to get in touch with that GI physician and look at possibly making a plan of taking that out or putting in another one. They only typically last about 3 to 6 months anyway. I will tell you that the physicians in New York never felt like I needed it. And my medical oncologist here felt like I didn't need it, but a second opinion felt like I needed it. And that's how I ended up with it. But that would be the reason why I never was drawn to this. And they said I probably never should have had it in the first place. But neither here nor there. Hopefully that can get taken out, and maybe that will relieve some of the discomfort that I feel in that upper abdominal area. I'm hoping anyway. So, but other than
Is it
that,
still only at night you're having the pain, or do you
no,
still
I
have
have
it
it during the day.
Yeah.
Randomly, it'll just occur. Sometimes it's just like gut, like I think I should go. Type of thing, because you really like it's if you've ever had gas anywhere in your body, that cramp, that feeling it's that.
It's
Constant. No,
brutal.
it's brutal.
I say gas pain is like honestly
worst.
one of the worst pains. Like it's
one of the worst.
crazy, but it like is.
And it's called pneumobilia. So it's really air. Woo-hoo! That
Hear that,
in
folks?
there. Somebody asked me today, I wonder if we could put an NG tube in you and get that out, the air.
You would have to knock me out.
Me
You're
too.
right. Yeah,
But I
no.
want that air out my belly. Somebody asked me that, and I'm not sure.
Anthony's face is scrunched for those of you who can't see,
Well,
which makes me
well,
think it's
the
not.
pain is-
I was gonna say, well, you're
The pain is where is it?
yeah. Is it in your small intestine? Because if it's in your small intestine, even then, I don't know. If
I
that
probably need a
Just
dog.
gonna get pillows.
I mean, but I was like, I don't know.
king of the iris.
I just, can't wait for the day that
So then
This is in the past.
your April, right, is going to be your true next evaluation.
I will have another CAT scan before then, but that's when the radiation oncologist will look at it. Medical oncologists usually say, we're going to look at it in 3 months, but radiation oncologists are like 6 months. 6 months because he knows what he did. He created the calculations. He set that all up for it. So he knows how long it takes before he can really see the definitive end results of it.
I know it's a ways
It's
away,
okay.
but it's really like not. It'll be here
Yeah.
before you know it. Like
It
it's
will.
already like almost, the first of the year.
I can't wait for the celebratory party. I can't. I'm
Yeah.
like, when this
Well,
is
and
like,
you get
yeah.
4 months off of.
I get 4 months off from
Right.
treatment, and that I have to admit is amazing because I'm very, very, very sensitive to all of the medications, which they say that's a good thing, but it's a struggle for me. Like I still feel symptoms from everything that I've been going through. Everything. Like there are days where I'm like, somebody took the soul out my butt. Like literally, like honestly, I was laying back on bed after I got up, took a shower, got dressed, everything yesterday, and I was laying back down on the bed just because I felt like I just couldn't move. Sometimes it just hits me like that, And then other days I feel energetic. It just depends, So that's just kind of one of the things that you go through, but hopefully it all will pay off.
Well, no, I think it's something to be said because you get to like allow your body time to like recuperate and recover from months of poisoning.
From poisoning the
essentially.
entire body, then radiating a specific area with 25 treatments. The body has taken a beating. So I'm sure it needs a recovery period. I do worry about things that could happen from all of that. You know what I mean? Sometimes even though they do targeted radiation, you can't not hit other things. Like you're going to radiate other things that, weren't intentionally being to be radiated. It's just inevitable in the way it is. But all I can do is hope and pray that everything works out and this is a blast in the past.
Like a blast from the radiation.
So,
Exciting.
yeah.
Have you had anything fun going on at work? Work's never fun, but whatever, like.
Now with your new freedom of these next few months, do you have anything you really want to do?
There's
Ooh,
lots.
question.
That's a great question, Tom. And there's a lot. There's lots that I want to do. And you know what? Like I tell you all the time in every episode, that you have to live your life and do the things that you want to do. And I'm gonna do just that. Now, right now, we're having to rebuild from being off the past few months and using up our time and everything. So right now, we're just trying to, we can't take off work quite yet. But the moment we can, like, I need a cruise. There are things that I'm just really missing
Dude,
that I'm just gonna go and do them. Regards, get things that I want, furniture. I'm gonna get me some new furniture. I'm gonna just live the way I want. I'm gonna pay off my car. It's almost there, and I'm gonna just enjoy life, to the fullest. And that's what I'm gonna do while I am off from anything. Yeah.
How have you been kind of managing like your stress lately?
Mental health wise, up and down. I have my struggles. I have my days, my nights where I feel like somebody's throwing a dart at my head every time I turn around, and I just know it's the enemy just at me because I am blessed to. I feel like I'm winning at this whole situation with this pancreatic cancer, regardless. Where I feel like I'm winning. There's not a day that goes past that someone doesn't say, "You don't look like you have." And I know exactly what that means, which means I'm winning. So whenever you're winning, people going to come at you in other ways to break you. And it's hard. It's hard when you're already dealing with something that you're like, why me? Why did this happen to me? I'm a this type of person. I don't understand. And then you're dealing with other things outside of that. So my mental health probably has taken a toll lately with everything that has come at me. My poor husband is amazing because there are days that I'm like, I just can't do this. I'm going to be honest. I can't. Like, I'm not one to give up, but I'm tired. This is a lot on me, and I still don't know what tomorrow will be. And I just get very overwhelmed with everything that's going on and say, what am I doing? Like, and then I have to be wheeled back in. So just know that I'm human and this happens. And there are days that I'm just kind of like, this isn't fair that I may never see my daughter married with kids or my son, married with kids or whatever. Like, I think about those things. I don't want to, but I do because we all know that this particular cancer is one of the ones that many people do not survive it. They don't. And I will, but I'm just saying many do not. And those things do go through my head, and I do have my days, and and I struggle, and then I get wheeled back in, and then I get back on track again. So
Well, it's amazing. Like, it's amazing that you've been able to maintain such positivity throughout this because who wouldn't in your situation? Like, like you're gonna have bad days. Like, people who are not dealing with what you're dealing with have bad days. Like, of course you are, but you're like overall like will and faith and strength has been incredible.
faith, and it is definitely I do feel like when you feel positive, that's the result you see. And when people are negative and they're like, I'm sick, like I don't claim sickness. Like I don't feel like I'm sick. I feel like, yes, I am the vessel that's being used right now, but I think I'm the vessel for a lot of other people for some reason. Like I don't necessarily think this is all about even about it's actually a lesson for a lot of us. I don't know why, but it is. Because it's sort of like, why did that happen to her? Like, she doesn't drink, she doesn't smoke, she watched what she put in her body. Like, it just didn't make sense even to me, but it didn't need to because I just had to realize that, you know what, God's got me and that I'm going to, get through this. I really do believe thinking that we didn't see that tumor means that I already won. It's like a preparation for the day that they don't see that tumor. Like that minute of excitement was there for a reason because it's common.
Hell yeah,
Like
girl.
it's
Hell
truly
yeah.
common that it's no way that God would put me through or let me go through all of this without there being a happy ending. I don't believe that. So I will get to see my kids have a family and and I will have great kids and enjoy this life. It's just that when I'm on my little down trip, I just want to be pulled back in. And I get it together.
Yeah.
It's like it's usually a night, sometimes it's a full day. Yeah. But then it's not really anything that I allow to linger on, and I don't allow other people to really see it.
14 Christmas trees.
What the Christmas
Yeah,
tree?
well, each-
Well,
Yeah, we
speaking
got
for those of you who are joining us, like are watching us, going to be here or on the YouTube channel, let's take the tour of your house.
There's no spot for these pillows to go anywhere else.
That's a lie.
He's so crazy. I'm gonna try to join on this other one. I don't know. I said it. We don't quite know what we're doing.
It's a free day today.
Yes.
What
This
is
is our let loose and
Yeah.
wow.
I know we're just having like a good time. It's
Diet
like
Coke.
we don't get to hang out much
Right. It's
anymore.
real
So
wine.
The
yeah,
Diet
that's
Coke
his
is-
Diet Coke wine.
I just want to feel like this.
The rest of us, we had
I know. I was like, we don't really drink, so
we had lemonade. You know I'm not drinking. I probably
no. You
should.
probably do you even drink like really much anymore?
Not as not.
I'm with you.
I'm gonna try. We're gonna do this because my computer battery's dying. We've already been here for an hour, and we've almost broken 100 things. So okay, guys, come with us as we take a tour. Okay, so this is Felicia's living room. For those of you who can't see, she's got a beautiful white Christmas tree. There is lights all around. There is decorations all over. This is her lovely table. It's gorgeous. Her couch has got the beautiful whiteness on it. She had some stuff I had to move because that's where we put our podcast. She's got another like little Christmas tree here. She's got like little fake snow and snowmen on the table there. It's so cute. Coming into, she's got in the kitchen. So she's got another Christmas tree over there. She's got all of her like elves and Santas, all of this stuff going into her kind of, I don't know, foyer here. She's got another beautiful Christmas tree. This is probably my favorite place in here. And this is like her kind of formal living room. The lights are off. Felicia, how do you turn this light on? Because this is like a whole like candy cane Christmas in here. So she's got another tree right here. She has also got just like candy canes all over, some red lights, just some beautiful like Merry Christmas stuff. It's kind of like pink and white. It's beautiful. And then she's got two more Christmas trees. One's in her daughter's room and one is outside on her patio. But her house is spectacular, Felicia. I'm so happy that you actually did it. Yeah, we kind of look from afar, but we can go look up close.
Yeah, go check out Lady Tree.
And then, like we said, we're gonna go check out Lady Tree. I'm just walking around with my computer throughout her house right now, so it's fun. But yeah, she's got Lady Tree, so it's like a body, and then it's got the tree part. So yeah, it's beautiful. So once again, we say this every time. We are so grateful for anybody who's watching, listening to us. All of the fun things.
One light says that.
White ones. So this is going to be the end of our first season of Hold My Stethoscope. We're very happy and grateful for everybody who's listened, even if just once. We will be coming back for our second season in the new year. So you get about a month break from us talking to you each Wednesday, but we will be back in the new year. We will definitely have our lovely special friends on again.
Yes.
Expect some new friends coming in the second season, and
Some new formatting, baby.
don't forget that that we have a forms that you guys can fill out to submit your stories. Thank you.
Happy holidays.
My mom my mom is joining us live, so we love it. Hi, Mom. And she's been Felicia's biggest fan, so I know
love
she's
your mom.
excited.
I love her.
Yeah.
Thank you so much for all the support that you give.
Merry
Christmas to you too.
All right. Yes. Everybody, Merry Christmas. Happy holidays. We love you guys.
Love
See you in the
you guys.
new year.
Already?